When it comes to hospital safety, North Dakota ranks among the lowest percentage of top grades in the country. So says a nonprofit survey aiming to help patients select better health care. Valley News Team's reporter Rose Itzkovitz looks into just what that means for patients in Fargo.
The report cards are in. A national nonprofit wanting to push hospitals to provide better care by grading them in an A through F system just announced their fall 2017 results, and North Dakota didn't do so hot. It's one of the 5 states in the country with the lowest percentage of A's for safety that looks at everything from hand washing to having enough staff on hand. Here in Fargo, Sanford Medical Center receiving a C and Essentia Health a B. I asked Leapfrog's communications director what that means.
The hospital safety grade is an analysis based on 27 different measures of patient safety, all having to do with how well hospitals are able to protect patients from harm in the hospital.
Looking back at past grades, Sanford Medical Center receiving an A as recently as 2014, which Mobley calls disappointing.
They've obviously proven that they can do really well on keeping patients safe. And so it would definitely be important for them to go back to those practices and look closely at what they were doing a few years ago that they appear to have stopped doing.
Meanwhile, though Essentia Health gets a B, it's actually gone up from a C last spring. Both Fargo hospitals responding in statements say they don't participate in the survey, which can affect the data. And maybe safety grading isn't the be-all end-all when looking for health care. A 2014 article published by the American Medical Association cites little difference in mortality rates between A, B, and C grade hospitals. But it did find a difference between the top 3 grades and the D and F hospitals. The article suggests using a pass-fail method instead of grading A through F. But Erica Mobley of the Leapfrog Group stands by their method.
So the methodology that we've developed and the methodology that we use has been peer-reviewed and published in the Journal of Patient Safety.
Still, she says, in an emergency, it's best to get to the closest hospital possible. Rose Itzkovitz, Valley News Live.
For both hospitals' full statements, as well as more information on how the surveys were conducted, head to our website and click on this story.
The Dakota Marker is on the line this weekend. We'll preview NDSU versus SDSU later in sports.
Up next, find out if the costumes you're wearing or seeing tonight are the most popular.